friends, welcome to a new lecture on foreign body on the X-ray. So this is the X-ray showing a foreign body ingestion. It is a child X-ray. If you see, the skeleton is very small, so this is the X-ray showing foreign body ingestion. I would like to even show you some more X-rays. So this is one more X-ray. In this, if you see here, I will just bring it to you a little nearer. Here you can see some lesions which are lytic lesions in the bone. Okay, so these lytic lesions in the bone are there. So there are maybe many causes of lytic lesions in the bone, and among those many lesions, one of the lytic lesion cause is hypoparathyroidism. So how are you going to treat hypoparathyroidism? The treatment of hypoparathyroidism is by giving drugs. Parathyroid hormone should be replaced. So this is just one of the cause of lytic lesions of the bone, but here mainly in the X-ray you can see many lytic lesions of the bone. And there is one more X-ray which you can see here. This is an X-ray kidney ureter bladder. So it is an X-ray of KUB view, and it is a plain X-ray KUB view showing radio opaque density. Okay, this is a radio opaque density in the kidneys. So you can see that this is kidneys. So it is a radio opaque density in the kidneys, which is suggestive of the caliculi in the stone. So it suggests renal caliculi, and in the renal caliculi it suggests staghorn caliculi, right? So it looks like a staghorn caliculi. So how are you going to treat this staghorn caliculi? Because it is a bigger caliculi, you cannot do percutaneous staghorn caliculi. You cannot try PCNL, that is percutaneous nephrolithotomy, or extracorporeal shockwave lithotripsy. Normally percutaneous PCNL, percutaneous nephrolithotomy, it can be tried if possible, but extracorporeal shockwave lithotripsy cannot be tried, because if it is less than 2.5 centimeter, stone will only get fragmented by ESWL. So this is the staghorn caliculus. So you can either do PCNL, or you can even do pyelolithotomy, where you will just give an incision in the in the pylorus, in the pelvis, renal pelvis, in the renal pelvis, you'll just give an incision, and then you will remove the stone by an open surgery. That can be done for this. Okay, so this is renal caliculi, that too staghorn type of renal caliculi. Okay, I would like to show one more X-ray today. So in this X-ray, this is an X-ray of chest. So in this X-ray, what are we going to see? So you'll have to say as it is a chest X-ray which is anterior-posterior view. Okay, this chest X-ray, it shows pleural effusion, that is, there is radio opaque density which is seen, not radio opaque density, you should say has a here you can see for any chest X-ray you'll have to start like this. First you'll have to see all the boundaries. You should not just concentrate on this lesion. You'll have to first see whether the trachea is central or not. You can see the trachea is central in position, and all the ribs, then you'll have to see all the ribs and the vertebral column. If you see the vertebral column and ribs, they are normal, and then you'll have to see the cardiac shadow. The cardiac shadow is normal, and then you'll have to see the diaphragm. On one side the diaphragm is normal, and cardiophrenic and costophrenic angles are normal, but if you see on the other side, the costophrenic angle is obliterated. Here the costophrenic angle should be there. That costophrenic angle is obliterated, and even cardiophrenic angle is obliterated. So because of the obliteration of costophrenic and cardiophrenic angle, there is some opacity here. So here this opacity is radio opaque, so it is most probably pleural effusion. Okay, so these are the surgeries. These are 4 surgery X-rays which I have in my practicals. So thank you guys for watching my lecture. If you have any doubts in the X-rays, comment in the comment section. If you want some more X-rays, you can even comment it in the comment section. I'll try to upload them. So thank you for watching my lecture. Thank you.